Okay, so for people who say, well, like the meatless Mondays, I'm going to cut down on my meat, I'm going to cut down on my fish. We'll have to talk about fish too. Is that enough, or does your research show it really has to be a full-time way of life?
Well, I mean, look, any steps people can make, right? Smoking 1 pack a day is better than 2 packs a day. And you can actually see differences in lung cancer risk by how much. It's not binary. It's not all or nothing. It's not black or white. You smoke socially at a party, a few cigarettes a year, you probably won't have much increased risk. In fact, one would be hard pressed to show any increased risk over people that are strictly non-smoking. Of course, we don't encourage people to smoke anything because they might go down that slippery slope and end up smoking a pack a day, which would dramatically indeed increase their cancer risk. But look, it's a similar thing. Anything they can do to move away and move away from cigarettes, anything we can do to move along this spectrum towards healthy eating would benefit our health. Look, you could choose moderation, hit yourself with a smaller hammer, but why beat yourself up is all. As a physician, I just look here. I just lay out the potential consequences of one's actions. But when it comes to my smoking patients, I don't tell them to cut down a half pack a day. I tell them to quit. Sure, a half pack a day is better than 2 packs, but ideally we should only put healthy things in our mouth.
Okay, so that's well said, and I want to definitely emphasize the fact that what you're saying with this analogy, in your analogy, the meat, the dairy, the processed, and I guess fish as well, Dr. Greger, I'll check that with you, fall into the category of the smoking or the hammer that you just referred to.
Correct.